What will be the human resources priorities in 2025? By Team 3. Sharon Griffin, Simone Johnson, Avneet Nibbar, Denise Page, and Collie Watkins. The healthcare industry in the United States has been depicted as one of its own among the advanced industrialized countries. There are approximately 5 varying macro trends that are going to stimulate the healthcare industry in the country. The trends include economy, technology, government policies, demographics, and personal lifestyles and behavior. The mentioned macro trends have been playing a vital role in the healthcare system and are projected to possess a great influence on the future of the country's healthcare system in the next 2 decades. Economy. The healthcare performance is heavily reliant on the economy. The rising cost of the healthcare is going to be a top issue that will need to be addressed effectively. The economy will also have to accommodate and facilitate the high number of the health professionals that is anticipated to rise. Macro trends in technology, medical robots. The rapid advancement in healthcare is giving rise to an era of medical robots. Medical robots are used for specific areas in medicine. In surgery, a well-known surgical robot, Da Vinci Surgical System, introduced some years ago, allow for more precise operations. Companies such as Johnson & Johnson and Google have been collaborating to create a new surgical robot system within healthcare. Axis. A robot created by Cambridge Consultants is a robotic surgical system used in eye operations. In hospitals, robotic nurses in hospitals are being used for repetitive tasks such as checking vital signs and drawing blood. In Belgium, a robot named Pepper is a social robot that is used in hospitals to greet patients. Pepper is programmed to recognize voices and to smile and greet everyone the same. Xenex, created in Texas, is a medical robot used to disinfect hospitals. This robot has decreased hospital-acquired infections. Other medical robots. There are remote-controlled robots that will interact with patients, basically acting as aides. Exoskeletons are robotic devices that assist paralyzed victims in walking as well as those in rehabilitation facilities. Chemical testing. Robots are being designed to withstand dangerous chemical testing that would be detrimental for humans. Ingestible robots, called origami robots, are tiny robots that are frozen in an ice block and ingested. Once swallowed, the ice melts and the origami robot unfolds in the stomach, healing wounds, repairing damaged cells, and removing foreign objects. Federal and state government policies. The U.S. healthcare legislation enactment of the Patient Protection and Affordable Care Act of 2010 brought about policy change at both the federal and state levels. Healthcare reform has been a major topic that has influenced both federal and state policy changes over the years. The latest is the Patient Protection and Affordable Care Act, which was signed into law by President Barack Obama on March 23, 2010. The Affordable Care Act is the single most important healthcare legislation enacted in the United States since the creation of Medicare and Medicaid in 1965. It is designed to improve accessibility, affordability, and quality of healthcare. Since the Affordable Care Act was signed into law, the uninsured rate has declined by 43%. From 16.0% in 2010 to 9.1% in 2015. The Affordable Care Act has also initiated the creation of the Centers of Medicare and Medicaid Innovation (CME), which is a division that is tasked with revitalizing and sustaining Medicare, Medicaid and the Children's Health Insurance Program (CHIP) programs to ultimately improve healthcare for all Americans. Demographics. Demographics includes location, age, race, ethnicity, and cultural differences. For these purposes, the demographic of focus is location. A person's location can have a great impact on their health care. Living in a rural area can mean poor access to care, which limits a person's ability to get frequent checkups, be seen for a sick visit, and stay on top of chronic conditions. Not having the availability of these things can lead to unnecessary hospitalizations. Primary care offices who offer transportation to appointments can make sure patients are seen regularly, illnesses are addressed early, and can prevent unnecessary hospitalizations. Personal lifestyles. A healthy lifestyle is eating a healthy diet, exercising, not smoking, and managing stress properly. Cardiovascular diseases are one of the top 10 causes of death in our country. A significant amount of money is also spent on managing cardiovascular disease. This cost can be decreased just by adopting a new, healthy lifestyle by eating healthy, exercising, stop smoking. By doing this, we decrease some of the stress in our life, which then leads to a better quality of life. Personal behavior and lifestyle have been impacting the management of healthcare lifestyle, and it has been one of the trends that need to be considered in predicting the future of healthcare in the United States. Healthcare is already starting to consolidate, and it will only grow as time goes on. By the year 2021, this consolidation will have a large influence on behavior health. Based on the macro trends, the most probable job opportunities include health economist, medical roboticist, health policy analyst, patient engagement manager, and lifestyle coach. Health economists. A health economist will be necessary to advise the government on the profound and best cause of action regarding the policies of medical application of drugs, national health programs, and insurance. Economists also focus on how the resources and the maintenance of occupational health are distributed in the healthcare system. Medical roboticist. With the increase of medical robots, there will be much need for medical roboticist. According to the medical futurist, by 2020 surgical robotics sales are projected to double to $6.4 billion. The growth of telemedicine will cause innovations in medical robotics. McManus, 2017, states patents are pending on ever more futuristic robots for the healthcare field. Health policy analyst. A health policy analyst will be necessary to ensure utilization of resources and integration of statistical information as well as recommendations from physicians to advance advantageous health programs and initiatives that improve public health. Patient engagement manager. When looking to the future of healthcare, resolving barriers to care, such as transportation or access to office visits, will create multiple job opportunities. This position could include overseeing transportation for patients, community outreach workers for patients that have been lost to care, and even a telemedicine team to allow patients access to care even if they cannot come into the office. Wellness coach. There will be an emergence of wellness coaches as we change our current lifestyle to a healthier one. These coaches will help people implement healthy eating habits and will help people cope and manage their stress better. Coaches will be able to reach people in person and through online sources. The United States healthcare system is a broad and enormous, diverse industry, and it is affected by both the long-term and short-term macro trends. With the rising number of aged population, there has been an increased need for specialized care, a factor that has led to increased job opportunities in technology and innovation. The mentioned job opportunities will be the most sorted by the year 2025, and the healthcare industries will have to expand the human resource department.